Now, if you will just take a look and you'll see where we applied the disclosing agent, you'll see different shades of pink. The light pink is just areas of accumulated plaque through the day, and that's normal. The darker pink is where the plaque has sat for a longer period of time, and you'll notice that it tends to sit closer to the gum lines and even in between the teeth, because it's hard to reach that with a toothbrush. So you're doing a great job, but I'm just going to show you a couple of techniques that might help you reach that plaque a little better. And you might wonder why does it matter? Well, the plaque, when it sits there, it can irritate your gums, and after a period of time, it can seep up under there, and it can even harden, which can cause gum disease and even periodontitis, which will eventually lead to bone loss and a lot of other serious problems. Personally, I know I'll reach, sometimes get just a little bit of swelling that's irritating, and that's just normal. But if we can do these techniques, it'll help with that. So for you, I would suggest when you brush, angle the brush towards your gum line. We're just going to kind of vibrate back and forth. And we're going to do that for about 10 seconds on each section, all the way around. And then on the bottom, you'll angle it down towards the gums. And then, really important, a lot of people forget the tongue side of the front teeth. So we're going to angle your toothbrush down and almost flick it up on those bottom teeth. And on the top teeth, we'll do the same thing and flick it this way. So if you want to try that.
So I just kind of angle it here and go back and forth kind of like this.
Mm-hmm. Small vibrating motions.
Kind of just same around. Then when it comes to inside the mouth, you just kind of do the same here.
Mm-hmm.
But the only difference is here I'm going to just flick it.
Right. Because this is a bad area of accumulating the harder plaque that can turn into tartar. So we really want to work on those areas. Well, good job. All right, now let's demo some floss. It's really important to floss because we think by brushing we're reaching all of these areas, but there's so much area in between these teeth that the plaque can accumulate and collects bacteria, and we just don't realize how much of that we're missing. So when we floss, it's important to wrap around our middle fingers, and I know a lot of people do it around their first fingers because it just seems natural, but those two fingers are going to hold our floss and guide it because we don't want it to snap in our gums and it can damage our gums. So we're going to guide it with our first two fingers and just kind of seesaw it between those teeth until you feel it snap between the contact. And we're going to go further than just between the teeth and go all the way into that gum line on either side, and then bring it up the side of the tooth at least a couple times, and then you can snap it out. It's fine. And we're going to do that between all of our contacts and go on the side of each of the gums between the teeth and pull all the way up. And we don't want to pull the tooth out.
No, that probably do that.
All right, you want to try that? Don't want to tie it around my finger either. I can hold that for you.
So you wrap it around
Your
the middle fingers because we're going to use these fingers to help push it through.
Mm-hmm.
Alright, so you kind of saw it back and forth till it's through. And then you wrap it around the tooth and
Wrap
rub it
around the
up?
tooth and go all the way down into that gum line.
Okay, so go below like
Below that little triangle of gum,
Okay.
you want to take it down in there. And then pull against the tooth, kind of scraping it.
Okay.
Good.
Alright.
Now, these back teeth are usually harder to reach, and so a lot of people will just miss those or skip them. You can buy a floss holder that will help you, and you can reach all the way back in there. And even though there's not another tooth against this back tooth, you're still going to want to hug it around that back tooth and pull up.
Okay.
And if you're finding it hard to reach back there, a lot of people don't realize that you feel like you want to open bigger, but if you close down, it's easier to reach back there. So
Okay.
that's just something that may help you.
Okay.
Now, another reason we want to clean all the plaque and keep those areas clean is because the plaque is full of bacteria, and if left on these teeth, they're going to turn into possible cavities, and it'll also harden into tartar, which is a lot harder to clean off. So this way we'll be preventing all of that from happening. But other than that, do you have any specific concerns or questions you might want to ask?
I do have a little bit of sensitivity kind of back here on this back tooth.
Okay.
Like, what would you suggest that I use, like, in order to help with that?
Is it sensitive to hot and cold, or
Mostly to
chewing?
the hot stuff.
Okay. I would recommend Sensodyne toothpaste, and I can give you a sample, but you can purchase it at any Walmart or drugstore. Make sure when you use it, you continually try it for at least 2 weeks, because it'll take a little while to start to work, but it will start to work, and it will help tremendously. So I think that should help you out.
Also, like, I like mouthwashes because I like the clean feeling it gives me afterwards. Like, is there one that's better than the other, or what would you say?
I would suggest Listerine. It's just one of the best out there, and you'll kill lots of bacteria. And that's a great question, because a lot of people don't use a mouthwash, but it does help tremendously with killing